Okay, welcome to my Boney Landmarks of the hip, pelvis, and femur. We're going to be looking at the anterior portion of the femur, the pelvic bones, separately called innominate, and briefly at the sacrum. So we'll start off with the superior, or rather proximal, end of the femur. Here's the head. This is the ball. As you can see, the ball and socket in the hip joint here. There's a divot in the medial portion of the ball, and it's called the fovea, and that is where the ligamentum teres, or the round ligament, sits. It supplies blood flow to the head of the femur and also a little bit of support. Not a lot, but a little bit. This is the anterior portion of the femur. So the head. Here's the greater trochanter. This is the neck right in here. So there's the head, greater trochanter. Here's the neck. This is where you have sites for hip fracture. The greater trochanter is an attachment site for a lot of muscles, the external rotators, the gluteal muscles, and then on the medial side is the lesser trochanter, which you can see clearly right there. You cannot palpate that. You can palpate the greater trochanter if you just place your hand on the outside of the person's hip. And the intertrochanteric line is a line, a bony landmark between the head and the greater trochanter. You can't always see it on a plastic model, but this is where it would be. Or right there. Turn to the posterior part of the femur, and you have a long ridge on the posterior part of the bone, and that is where the adductor muscles attach, and vastus lateralis and vastus medialis. The line will separate as you get more proximal. The medial side is the pectineal line, and the lateral side is the gluteal line. So that pretty much does it for the femur. Know which is the anterior and posterior view of the bone, and pick out whatever bony landmarks make sense to you. Next we'll go to the pelvis. The pelvis is made up of two sides. Separately it's called the innominate bone, and I happen to have one right here. The innominate bone, this one is the left side, matches up nicely here. You can tell because this is the pubis area. The ilium area is concave. If you turn it around, you might get a little bit confused, but the acetabulum, the cup or the socket of the hip joint, will have to point out laterally. Pubic bone will be on the anterior surface. So the ilium, the pelvis is made up of three bones. The ilium, which is this large area here. The ischium, which is this portion here. And then the pubis, which is this portion here. All three bones fuse together, and all three bones are made up, comprise the acetabulum, or the socket of the hip joint. So this would be the ilium, this would be the pubis, and then down below this would be the ischium. Now I'll go into more specific parts on the pelvis itself. So if you place your hands on top of the iliac crest, is something that you can palpate, and you come forward. Normally people say that your hands are on your hips. This is your hip, but this is the top of the ilium. This is called the iliac crest. Come forward and you feel a bump. This is the anterior superior iliac spine. Go a little bit more forward or anterior and drop down inferior, you have the anterior inferior iliac spine. This is the ASIS. This is the AIIS. Iliac crest, we'll turn it to the posterior view. And if you have your hand on either side of the iliac crest, you will, horizontal plane, you'll come in contact with L4. So from the posterior view, you have a PSIS, which is the posterior superior iliac spine. So as you run your hand over the iliac crest, you come to a large bump. You can scoop up underneath that bump and determine the level of both sides of the pelvis to see if they're equal, or if there's a rotation involved. So this is the PSIS, the posterior superior iliac spine, which you can palpate. Below that is the posterior inferior iliac spine, which you cannot palpate, but this is still part of the sacroiliac joint. You see that the sacrum sits in between these two bones, and this whole area in here is the sacroiliac joint. But for palpation, when you have your client on the table, when you find the PSIS, you know that you're in the SI joint area. You find the PSIS, you come in medially just a little bit, and you'll dive into a little sulcus area, a little divot or a dimple, and this is at the level of S2 on your sacrum. When you go below the PIIS, you'll have a little bit of a curve, and this curve here is called the greater sciatic notch. This is where the sciatic nerve comes through the pelvis after it comes together, after it comes out of the sacrum area. At the bottom of the greater sciatic notch, you have the ischial spine. This is an area where you have ligaments attaching from the spine to the sacrum. Below that is the ischial tuberosity. This is also called the sits bone. And the ramus of the ischium would be this portion here, this skinny portion here. This area would be the body. Whatever connects into the acetabulum would be the body. Coming back around to the anterior view is the pubic bone. The pubic bone is this area of the pelvis, this top part being the superior ramus, below is the inferior ramus, and up in here would be the body. This would be the part that connects into the acetabulum and is part of the hip socket. You have a nice big hole right here on either side that's just above the ischial tuberosity, and this is called the obturator foramen. On the front part of the ilium is called the iliac fossa, and this is the spot where the iliacus muscle originates, combines with the psoas, the iliacus, joins to the lesser trochanter. And then, of course, the acetabulum is the actual socket of the hip joint, the ball and socket, made up of all three joints, or all three bones. Briefly with the sacrum, this is the posterior view. Here's a side view, and here's the anterior view. You can see how much of a curve it has. So if you land on your tailbone, you could bend your coccyx forward a lot more. The area of S2 is where you can palpate the sacral sulcus. This whole surface here is the SI joint. This is the sacral part of the sacroiliac joint. And here is the connection between the sacrum, S1, and L5. The sacrum, L5, L4. Sulcus, PSIS. Iliac crest, greater sciatic notch, ischial spine, ischial tuberosity, obturator foramen, ASIS, AIIS, superior ramus of pubis, inferior ramus of pubis. Head of femur, neck, greater trochanter, lesser trochanter. This is a disc between the two pubic bones, pubic symphysis. The pubic symphysis and the sacroiliac joint move together. So if you have one bone, one pelvic bone that will rotate, this will go forward in a right rotation. You'll have a high PSIS, you'll have a low pubic ramus. On the left side, you would have a high pubic ramus and a low PSIS. I guess that's it for now. So thank you very much.